Hello friends, welcome to Dr.Bone YouTube channel. Today we are going to talk about the topic steroids. So what are steroids? So a steroid is a carbon compound with four rings in their structure. So all these steroids who has carbon compound with four ring structure, they are called as steroids. We have two types of steroids. One is anabolic androgenic steroids and second one is corticosteroids. So anabolic androgenic steroids are the synthetic steroids which are similar to our male and female sex hormones, which are used for hormone replacement therapy. So how do these steroids work? So these steroids, whenever they want to perform an action, they pierce into the they pierce the cell membrane and get the acquired function. And few other hormones, they go and bind to the receptor and then they perform their action or to transcript their proteins. Now we will see what are all the sex hormones naturally available in both males and females. So we have follicle stimulating hormone and luteinizing hormone synthesized from the anterior pituitary gland, and these FSH and LH work on male and female organs, sex organs, that is testis and ovary, and they finally synthesize testosterone and estrogen and progesterone in from the ovaries. So let us see the testosterone, how this is synthesized. Now this is our male reproductive system, and here we have a testis, and in the testis we have so many lobules which are called as seminiferous tubules, and these seminiferous tubules has two types of cells. One is Sertoli cells and second one is Leydig cells. And these two cells, these Leydig cells are stimulated by the luteinizing hormone to produce testosterone, and the Sertoli cells, which are stimulated by the follicle stimulating hormone, they synthesize androgen binding protein, and these binding proteins binds to the testosterone and finally promote the sperm production in males. So in few patients, wherever there is less secretion of testosterone, the doctors can prescribe the synthetic steroids, and that will give the desired effect on the patient. Now we have estrogen, which is another steroid hormone which is naturally present in females. So now we are going to see how the ovulation happens. And here we have primordial follicle, which, which converts into primary follicle, and primary follicle to secondary follicle to Graafian follicle. And from Graafian follicle, this ovum is ovulated. So whenever Graafian follicle wants to ovulate the egg, this luteinized LH surge has to happen. What is this LH surge? Whenever there is rise in LH hormone in the body, then this ovulation will happen. And the remaining cells, after ovulating the egg, these cells form into a structure which is called as corpus luteum. So primary follicle is frozen, then FSH stimulates the primary follicle to convert into secondary follicle. Secondary follicle produce a hormone called estrogen. So this estrogen and progesterone from the corpus luteum, these two go and have an effect on the uterus by preparing the endometrium. So now we are going to talk about the progesterone. So the secondary follicle grow into Graafian follicle, and then luteinizing hormone stimulates ovulation. Corpus luteum starts producing progesterone as we have discussed. Now we have seen how these male and female sex hormones are produced. Now we are going to see about the adrenal glands and their glucocorticoids. So where are these adrenal glands in human body? They are present above the kidney. Now this adrenal gland has cortex, which is on the outer part, and there is medulla inside the cortex. Now this cortex is divided into three layers. First one is glomerulosa, and second one is fasciculata, and then reticularis. So this outer part, glomerulosa, secretes aldosterone, and then fasciculata secretes cortisol in stress conditions, and then this reticularis um, secrete adrenal androgens. So now, what is the function of this aldosterone? Aldosterone helps to um, save the water and sodium. And cortisol is a glucocorticoid, and then androgens deal with sex hormones. Now we are going to see what is the function of the aldosterone with this picture. Now here is the liver, and it synthesizes angiotensinogen into the blood. Now the kidneys, they release one enzyme called as renin, and when this renin is released into the blood, whenever there is low fluid flow or low sodium concentration in the blood. So this renin enzyme converts angiotensinogen to angiotensin 1, and when this angiotensin 1 goes into the lungs, this ACE enzyme, they convert angiotensin 1 into angiotensin 2, and this angiotensin 2 goes and stimulates the adrenal cortex to secrete aldosterone. So what is the function of this aldosterone? They go and stimulates this uptake of sodium and water, that is H2O. So finally, this is going to save the salt and water in our body. So aldosterone is a steroid hormone. It acts intracellularly. ACTH from pituitary gland and increased potassium from blood plasma also stimulate zona glomerulosa to secrete aldosterone. Now we are going to see the cortisol, which is a stress hormone. It is a steroid hormone. Hypothalamus under stress secrete CRH, which targets cells in anterior pituitary, which produce and secrete a hormone called ACTH. Now we are going to see how the cortisol has its effects on other tissues. Now cortisol is going to increase the appetite, and it also increases blood pressure, insulin resistance, and it increases the gluconeogenesis and lipolysis. And it also decreases fibroblastic activity and thus decreasing the wound healing. And it also suppresses immune system and inflammatory system. Now it also decreases bone formation. So this is a very major side effect which we are going to see in orthopedics. So whenever we give glucocorticosteroids in patients for a very long period of time, there are chances for inducing osteoporosis. Now, whenever this cortisol is present in higher levels, this can cause Cushing syndrome. Now, these androgens, which are secreted from the adrenal cortex, these hormones has a very less effect, and we don't know the function very clearly, and we didn't it's and the regulatory control and function of adrenal sex hormones is not fully understood. But however, these androgens, they cause the secondary sexual characters before puberty in both males and females. Now, as a part of completion, we are also going to talk about the adrenal medulla, which secrete epinephrine, and it is a peptide hormone, and it is not a steroid. So it increases the heart rate and contractility. It also increases blood pressure, and it causes bronchodilation and pupil dilation. Now we are going to see the classification of glucocorticosteroids, and there are three types. First one is short acting, that is cortisone and hydrocortisone comes into this group. Now we have second one, that is intermediate acting, which is and there are prednisolone, triamcinolone, budesonide, and methylprednisolone. And the last one is long acting, which are betamethasone, dexamethasone, and paramethasone. They remain in body for more than 36 hours. Now, we should also see what are all the uses. Glucocorticoids exert both anti-inflammatory and immunosuppressive effects, which we have already mentioned earlier. Now, it also has antenatal use, as we already know that to deliver a baby, we need 37 to 42 weeks of gestation. But however, to get the lung maturity, the minimum gestation is 34 weeks. If any delivery happens with a premature baby, then we can also use glucocorticoids. Now, it is also useful in the treatment of rheumatoid arthritis, asthma, and chronic obstructive pulmonary disease, and then lupus and other autoimmune disorders, multiple sclerosis, and eczema. Now, we have to see what are all the adverse effects of steroids. So, in eye, it can cause cataract and glaucoma, and in cardiovascular system, it can cause hypertension, water retention, hyperlipidemia, congestive heart failure, and then gastrointestinal. It can cause peptic ulcer and pancreatitis. Whereas in skeletal muscle, it can cause myopathic pain and then osteoporosis. And in neuropsychiatric, we can see mood swings, changes in mood, or psychosis. Skin. In skin, it can cause hypertrichosis, acne, allergy, and dermal atrophy. Immunologically, we can see immunological suppression and then infection, hyperglycemia, growth retardation, and metabolic acidosis. So, whenever we are giving steroids to the patients, we should keep on monitoring hypertension, diabetes, lipid profile, and bone mineral density. So, these are the equivalent doses of various steroids. This is how we are using. The three steroids which we are using commonly in our OPD is deflazacort, prednisone, methylprednisone. So there is another vitamin which is also a steroid, and as a part to finish everything into in steroids, I'm also mentioning about vitamin D. So vitamin D is normally synthesized through our sunlight, that is ultraviolet B rays. Whenever the ultraviolet B rays um, falls on our skin, this 7-dehydrocholesterol turns into cholecalciferol, and with the help of the enzyme from the liver, it can be converted into calcidiol, and then which is converted into calcitriol with the help of the enzyme from the kidney. And this vitamin D helps in maintaining the calcium and phosphate homeostasis. So Under 1 year age, 400 international units is the recommendation. And from 1 year to 70 years, 600 international units should be fine. And then more than 70 years, 800 international units per day. Vitamin D deficiency in children causes rickets, and vitamin D deficiency in adults causes osteomalacia. So whenever you take excess vitamin D, that also harmful to our human body. So what are all the problems which we can see? So it can cause renal stones, and then it can also cause bone pains, and third one is it can also cause abdominal pain, abdominal muscle pain, and it can also cause pancreatitis, and you can also see altered mental status and confusion. So I hope that should be useful for everybody. So this is the topic on steroids. Thank you.